Homeland Security knows it has a problem after the death of those two children in their custody, which is why yesterday Secretary Kirstjen Nielsen ordered a review of the Border Patrol's medical screening procedures, more EMTs to remote border areas where acute care is hours away, a medical exam for every child currently in custody, and the CDC, Centers for Disease Control, will now investigate why so many arriving Central Americans need hospital care. Finally, can ICE expedite transport so immigrants are not in detention any longer than necessary?
It's really about is thwarting human trafficking. It's about curbing the drug cartels. It's about slowing down this flow that's coming into this country illegally.
But it's also about sending a message, in this case, the wrong one. Shelters in the U.S. are so full, ICE released 500 newly arrived immigrants at a Greyhound bus station this week in El Paso. And despite the president's claim that catch and release is over, it isn't. The Border Patrol and ICE are between a rock and a hard place, trying to meet court-ordered mandates limiting detention time, yet with no place to put people, they go free. The cartels know it, and so do 150 million Central Americans.
They have spent 8 to 10 days in cells. Now they've been released. What we've been doing as a community is to support them, giving them food, a place for them to stay at night.
So despite the administration's effort to reverse or stop the surge, prosecute everyone, workplace enforcement, close the border, only ports of entry for asylum seekers, separate families, more foreign aid, deals with Mexico, Rick, nothing is working because of the stalemate in Congress and court challenges. The immigration, according to the Secretary, is at a breaking point.